Dr. Rona, would it be safe to say that the B complex are one of the most important vitamins in the system for the nervous system as well as for energy?
Absolutely. I think the nervous system cannot survive properly without B vitamins. And our energy is highly dependent on B vitamins because we use them all the way through our metabolism of carbohydrates and in the production of ATP and energy.
What's ATP?
Adenosine triphosphate.
And what is it?
It's basically energy is what it is.
Ah.
Yeah, so we need that to create energy, yeah.
Mm-hmm. And the B vitamins are water soluble, so they don't store in the system?
That's right.
So people can take high doses, is that correct?
Yes, with some warnings. I mean, there are some limits to taking some of the B vitamins. For example, if you take niacin in excess, if you go well above 3,000 milligrams and you do that on a regular basis, it can irritate the liver. It cannot really produce any severe liver toxicity or death, but it can cause some other kind of side effects like severe itching and various rashes.
Should people take the different Bs, like B6, for example, higher doses without taking the B complex?
No, that's a bad idea. You can do that for specific medical concerns, but whenever you take a separate B vitamin, you should always flank it with a B complex because that way you won't create relative deficiencies in the other B vitamins.
So they work synergistically?
Yeah, that's right. Adele Davis, years and years ago, she was one of the first ones to recommend that people take B vitamins together so as to avoid a deficiency in other B vitamins.
Now, the TriStar formula, I noticed, doesn't use niacin, it uses niacinamide, which doesn't cause that flush, but other formulas, what is that flush?
Well, that's actually the release of histamine. Niacin opens the arteries as well, so it has a vasodilating effect. It releases histamine so that you can have this kind of reaction where you turn all red from head to toe and you itch like crazy. And some people, it upsets their stomach, they get nauseous, they get very nervous, excited.
Is this a normal reaction to niacin, or is this a sensitivity?
It's a normal and harmless reaction that actually dissipates with time. In other words, the more you take it, the less that reaction occurs in future times that you're taking niacin.
And in what cases would you use niacin in high doses?
Well, it's been used in high doses in treating schizophrenia, other mental disorders. It's been used in very high doses to treat a very high cholesterol. Niacin lowers cholesterol very nicely. It'll lower it by 30% or more, depending on how much you take. And it does that without any significant side effects. People just don't like that flush feeling.
But can you use niacinamide instead of niacin?
You can use niacinamide instead of niacin, but it won't lower the cholesterol as much as niacin itself will.
I guess Dr. Abram Hoffer had used niacin almost exclusively in the treatment of schizophrenia.
Yes, he used niacin in very high doses, 3,000 milligrams, along with vitamin B6 and vitamin C, and he had some fairly good results with it.
Is there a lab test that can determine vitamin B deficiency? I know B12 you can.
Well, you can look at a complete blood count and you can see if there are elevations in the MCV, MCH, or MCHC. You can sometimes find low levels of vitamin B12 itself and folic acid. And you can actually do tests on the other B vitamins, but these are very costly to do, so most doctors won't order them.
So in your practice, would you use symptomatology just to go over symptoms with people?
Basically, yes. And if I found some signs of a lack of B vitamins, then certainly I would give the B complex.
I know that when people start taking B complex, they go to the bathroom, they urinate, and they go, "Oh my God, my urine is fluorescent. I'm wasting it all." Is that true?
That's vitamin B2. It phosphoresces in the toilet bowl. So that just means that you're absorbing it.
Not wasting it.
Not wasting
Not
it.
peeing it out.
It means that you are absorbing your B vitamins, and actually they used to use that as a way of seeing if people are taking their pills in hospitals. They would give them vitamin B2 and they would look in the toilet bowl, and if they saw it was very yellow, they knew that the patients were taking their pills.
Oh, that's very interesting. I hadn't heard that. So are deficiencies of B vitamins, is that common?
It's very common, and part of the reason for that is that people consume a lot of junk food, or they may not be getting enough whole grains, or they may not be getting enough vegetables. They may not be eating properly. They may be skipping meals, or they may be eating foods that are counterproductive, and so they are deficient.
And some people complain of this burping back the B vitamins, the B complex. Do you have any advice about that?
Well, the best thing to do is to take it with food, and possibly when you first start taking them, just take one pill and then gradually build up if you need to take higher doses.
How do you develop deficiencies to B vitamins?
Well, it's very simple. I mean, if you take certain medications, if you smoke cigarettes, if you drink alcohol, if you're exposed to various pollutants, if you're in an environment that isn't very clean, all of those things will destroy your B vitamins. Like, for example, alcohol would destroy most of vitamin B1 and B6.
That's most people, people's lifestyle habits. So would you suggest that
yeah.
most people take B complex?
Absolutely. I think especially if they're out drinking, one of the reasons why they may feel the hangover feeling the next day is because their B vitamins have been wiped out by the alcohol.
How can B vitamins aid in metabolism?
Well, they're very important. Whenever you consume carbohydrates, B vitamins are used up. Chromium is being used up, manganese, zinc, a long list of other nutrients. Vitamin C is used up. So basically, what the B vitamins do is they allow your body to metabolize the carbohydrates into energy. And if you don't have enough B vitamins, you basically will be tired.
Does it help in weight loss?
In some cases it does because, for example, vitamin B6 is very important in getting the kidneys and the liver to work properly. And if those organs are not working, you'll store a lot of the fat in the liver. Inositol is one of the B vitamins that without that, the body will store a lot of fat in the liver and will produce a fatty liver and will prevent you from losing weight. So all of the B vitamins are important in that way.
I'd also heard that B6 is really good in treating carpal tunnel syndrome.
Yes, in some cases of carpal tunnel, high doses of B6 flanked by the other B vitamins, very effective for reducing the pain and swelling, yes.
And what about PMS?
Yeah, it's been known for a long time. The vitamin B6 helps with fluid retention, depression, moodiness, PMS symptoms, sure.
Let's talk for a minute about B12 because, in Canada it's very controlled. Once a month, these poor older people who have a little bit of memory problems, brain fog, they're exhausted, they're depressed, and they go to their doctor, and once a month they get a shot. They feel really great for a week, and then it's downhill until 3 weeks later they get another shot. What do you think of that?
I think people should be taking more B12, especially if you're over the age of 60. The ability that your stomach has to absorb the B12 is significantly diminished. As a result of that, you're not getting enough of the B12 from the foods that you're consuming. So getting a shot once a month may not be enough. In some cases, I have had some patients, they get depressed unless they get at least 2 shots a week. So everybody's a little bit different, but I think certainly getting more B12 into your system is very helpful for the nervous system.
So any B12 that would be found in a multi-B, would you absorb any of that?
You would absorb some of it, but the older you are, the less you'll absorb. And you may need to get some lab testing done to find out if your B12 levels are adequate.
But are the tests, are they accurate?
They may not be sensitive enough. Some people have found, for example, that people that feel tired, their B12 levels on lab tests may be normal, but they still benefit from taking a B12 supplement because, the lab tests are not sensitive enough to pick up the problem.
I understand, too, I'd read somewhere that B vitamins are manufactured, some of them, in the intestinal tract, and that overuse and abuse of antibiotics is a huge problem.
That's right, because whenever you consume antibiotics, you destroy not only the bad bacteria, but the friendly ones in your GI tract. And they manufacture B vitamins. They also manufacture enzymes, immune system factors, and many other things. So you could be quite run down after taking antibiotics, and that's one of the reasons why. So taking a B compound is not a bad idea.
Along with the antibiotics?
Yeah, absolutely, because you're just making up for what's being destroyed by the antibiotics.
It's very important because this is a common problem. TriStar has added alpha lipoic acid to their formula. What is that?
Alpha-lipoic acid is an antioxidant. It's something that recycles antioxidants, so it makes them more powerful. It's been used extensively in the treatment of diabetes and hypoglycemia. It's something that regulates blood sugar very well. It's also something that will help the liver function better. So anyone with any kind of liver disorder, hepatitis, cirrhosis, cancer, all of these conditions are benefited by alpha-lipoic acid. So it's something that actually further boosts the benefits of the B complex vitamins, which are, for most people, are used for metabolizing carbohydrates. So if you add alpha-lipoic acid to the mix, you get better metabolism of carbohydrates.
A good solid B formula should have folic acid, is that correct?
Yeah, folic acid is very important. As you know, it's important to prevent birth defects. It's also important to prevent the accumulation of uric acid in the body that leads to gout. And it's very important for the nervous system in many other ways which we haven't yet discovered.
How much B complex should one take? I know some of them are 50 milligrams. This is another confusion for the public. How much should I take every day? It's water soluble.
Well, I think people can take probably 50 to 100 milligrams 1 to 3 times a day, depending on their needs. You know, so some people obviously who are on a lot of medications, where the medications destroy your B complex, they should be probably taking much more just to make up for what they're losing with the medications. And smokers and obviously people under a lot of stress should take more B complex vitamins. So it depends on the individual case.
Thank you very much.
You're very welcome.